This is another case. This is an X-ray humerus, right humerus, frontal projection of a skeletally immature patient, young patient. Here you can see a expansile lytic lesion that involving the metadiaphysia region, and you can see that there are, if you zoom this image, you can see a linear density fallen fragment sign is appreciated, and you can also appreciate that there is a break of the cortex, and this is pathological fracture, and this piece of the bone seem to floating in the bottom of this lesion. Actually, this is a case of solitary bone cyst. Solitary bone cyst is a benign lesion, and you can appreciate there is no soft tissue involvement and narrow zone of transition, no internal matrix, and this is basically cystic lesion. So I will give you some pearls regarding this solitary bone cyst, that solitary bone cyst will always be central. As you, when you write that solitary bone cyst, and C for cyst and C for central, always remember that a cyst that is in the central part of the medullary cavity. Always think about solitary bone cyst in a young patient. The second mnemonic for this solitary, as you, when you write the word solitary, it's uh, it's it's very similar to when you write word 30, solitary and 30. So always consider solitary bone cyst when patient age is less than 30, and when a person, and it's a uh, mnemonic that when a person is solitary, he has more happy and more fun, and F for fun and H for happy. So H for humerus and F for femur. So always consider in the proximal aspects of the femur and the humerus. So these three features are very helpful. So if a lesion is not central, then always exclude the solitary bone cyst in your differential. So this lesion is not subarticular, so we can exclude the differential of giant cell tumor, and other things that this is not joint cell tumor because growth plate is not fused. We can exclude the diagnosis of the, we can exclude the differential of the non-ossifying fibroma because non-ossifying fibroma will be eccentric corticated. We will also exclude the differential of chondromyxoid fibroma because chondromyxoid fibroma will also be corticated and eccentric in location. So uh, in this way you can narrow your differential. So not say that this is unicameral bone cyst and I will put the differential of chondromyxoid fibroma, I will include the differential of non-ossified fibroma, I will include the differential of giant cell tumor, but exclude your differential on this image by saying this, that this is not subarticular, so GCT is excluded. This is not eccentric, so this is non-ossified fibroma is excluded. So this is a good way. And second thing I want to share you, whenever you see a case of MSK radiology and chest in chest system, always ask about the previous X-ray, and you should acquire about two things on this previous X-ray. One thing is to say to the examiner that I want to see the chronicity of the lesion, number one. Number two, say that I want to see the any change in size of the lesion. So these are two very helpful features. And so this is a case of solitary bound cyst. And thank you very much. Hopefully this will be helpful.